A Winnipeg woman is calling for an investigation after the death of her mother over at St. Boniface Hospital. She says her mom's condition wasn't taken seriously by healthcare staff and she wants answers. Her mom, Judy Burns, was found unconscious in her home on the morning of January 18th. She was taken to the hospital. It's when her daughter says the struggle started. CBC's Gavin Axelrod spoke with Samantha Burns about her mom yesterday.
GI doctor came in and explained to us that our mom had diverticulosis.
Oh yeah, diverticulitis.
That means that's why she was bleeding. That's why she is confused. This is all normal. Your mom is elderly. She was not elderly. She was 68 years old. This was not her normal self at all. Being confused, not able to stand, that is not something our mom ever had an issue with. The GI doctor said that he would do a colonoscopy on her outpatient. He would request it. We requested that our mom get a scope, which was denied multiple times. After continuing requesting it, the doctor said if she bleeds again, we will do a scope. But unfortunately, by the time she was bleeding again, there was too much coming out of her and it was too late. She already coded. Our mom was not elderly, and even if she was, and they deserve the exact same care that I do or my 3-year-old son gets. Everyone deserves the same care, and just to be dismissing it as this is normal.
Samantha Burns speaking with CBC's Gavin Axelrod about her mom, Judy Burns' experience at St. Boniface Hospital leading to her death. As you just heard, she says she's concerned about ageism in the healthcare system. Laura Tamblyn Watts is as well. She's been on our program before talking about this. She's CEO of Canada's National Seniors Advocacy Organization, CanAge, and she's on Zoom today. Good morning.
Good morning.
What are your thoughts on hearing about Samantha Burns talk about her mom and what happened?
This is a tragedy, but it's a tragedy that we hear all too often. In fact, a 2024 study by Statistics Canada found that 2/3 of Canadian seniors had felt ageism had been really directly affecting them, usually affecting their health. There's nothing worse than going to a healthcare provider, particularly in an emergency situation, only to be dismissed. And 68 certainly isn't elderly. But again, no matter what our age is, we deserve the same attention, respect, and care of anybody.
What do you suggest a family does? I mean, not just even in this case, but if someone says to you in the healthcare system, this is normal for someone their age, what is normal for someone, who is elderly, for example? I know there's exception taken with that word, but I guess what do you suggest patients do to advocate for themselves? Is there a range of things we are supposed to accept that are normal?
It's very helpful if you can come with a bit of a notebook or a chart saying what your parent is usually like and talk about the differences between it. It really shouldn't matter what your age is, it's what your condition is. Is it a matter of frailty? Frailty isn't age, frailty is your healthcare condition. If she was walking normally before and is now shuffling, that's not due to age. That's due to some type of health condition. If her cognitive challenges are brand new and she never had them before, again, that change is different. Pushing back constantly about that is really the only thing that you can do, and make it extremely clear that you're not taking that as an answer.
I want to get to the label, I guess, the label elderly. You said you don't often hear it in someone that's 68. Do you hear that word, though, being a problem in our healthcare system?
Absolutely. And the word elderly is often code for some of the other words that we call people who are older. You hear the term bed blockers. You hear that people are stuffing up hallways full of older people who can't get into long-term care. And of course, it's not an issue that older people are facing. It's an issue of the inadequacy of our healthcare system. What we do know is that older people's pain, and particularly older women's pain, is treated as less serious. They're less likely to get follow-ups and tests, and they have a much harder hill to climb in justifying the very fact that they're there using our healthcare system. Our healthcare system is very concerned that people will get stuck in our hospitals and not be able to get discharged. And as a result, in many cases, they're not brought into the healthcare system appropriately for fear that folks won't be able to be discharged out again.
What questions need to be asked out of this case when we try to determine what went wrong here in terms of, I mean, there are mistakes that get made in the healthcare system. There could have been with diverticulitis. I hope I'm saying it right. Diverticulosis, pardon me. I don't know how often that is normal to leave someone who has had an initial bleed and such. But what questions would you have as they move forward looking at this?
Let's start off first at being dismissed. And the way that I understand the story unfolded, the matter was dismissed by any number of doctors as being elderly. And it's ludicrous that a 68-year-old woman who had a very acute change in her condition should be dismissed at all. She certainly isn't geriatric, even in the most conservative sense of the term. We need to know, why wasn't her pain and her condition followed up with? Why was she shunted off to an outpatient type follow-up? Why was she having to justify getting scans and conditions? This also, however, needs to be looked at in a more systemic issue. Certainly in the Manitoba healthcare system, we've had real problems with systemic issues, including racism. This is the time to have a look at the systemic issue of ageism as well.
What's it like for loved ones who have to advocate for parents and grandparents?
It's incredibly distressing. Often, doctors or healthcare providers will ask the younger person, the care supporters, what's happening with your mom? What's happening with your dad? First of all, they're supposed to be talking to the patient no matter what their age, if they can give consent. And when they are seeing that their loved one is not getting the care and attention that they deserve, and they're being dismissed out of hand, often overtly because of age, or even in many cases, covertly because of their age, it's hugely upsetting. You feel paralyzed, you feel scared, and you feel worried about your own journey. What is it going to be like when you're not 50, but you're 75 and you're trying to get care? So it undermines faith in the healthcare system for yourself, and it's incredibly upsetting when you're trying to advocate for somebody else.
Thanks for your time this morning.
Thank you.
That's Laura Tamblyn Watts, CEO of CanAge, National Seniors Advocacy Organization, weighing in on ageism, an allegation that a family has made here happened to their mom in our healthcare system here. She died in last month in St. Boniface Hospital.